Welcome, everyone. This presentation is entitled Beyond Surveys, a Model for Meaningful and Sustainable Family Engagement in MCH Programs. My name is Sarah Miller. I'm a program analyst at AMCHP. This session is accredited for continuing education. CE information is available on the conference website, mobile app, and at the registration desk. Please silence or turn off any cell phones or other mobile devices. Now it's my pleasure to introduce our presenters. Tamara Bakewell, Sylvia Mann, Jill McCormick, and Angela Lindig.
Hi, thank you, everybody. We are so lucky to get the coveted after lunch spot. So I'm going to let each of my co-presenters present themselves, but just real quickly, my name is Tamara Bakewell. I'm the Family Involvement Coordinator and the coordinator of the F2F HIC, Family to Family Health Information Center in Oregon. And I'm just going to pass the mic and let them introduce themselves.
Aloha, I'm Sylvia Mann, and I am actually the Genomic Section Supervisor at the Hawaii Department of Health. But in this talk, my role is as the Project Director of the Western States Regional Genetics Network.
I'm Angela Lindig, and I'm the Executive Director of Idaho Parents Unlimited, which is also the Family to Family Health Information Center, the state affiliate of Family Voices, and the Parent Training and Information Center.
Hi, my name is Jill McCormick, and I am the Director of Family to Family Health Information Center and Family Voices of Washington State.
And what we didn't tell you is that we're also parents of children with special health care needs.
Yes, thank you, Angela. I was thinking that as it was going down the way. So we are actually three parent partners, three parent representatives in the Pacific Northwest, as you can tell by our states. We're missing some of our colleagues here that work with Sylvia, and so I just wanted to give a shout out to the family partners in Alaska, California, Guam, and Hawaii that are here in spirit with us, because we have shared over the last 6 years, at least for me, a really wonderful partnership that when we got thinking, sometimes Sylvia doesn't know it, but sometimes as parents we actually talk online by ourselves, and one of the things we said is, we are so fortunate, so encouraged by the way that the partnership works with Western states that we really ought to shout that out a little bit. And so that's kind of where this workshop came from. Yeah, excellent. So we really wanted to draw, put a little sunshine on something that's going really well and hopefully use it as a model for some of you all. So as we were doing this, thought of a couple of different things that might ring a bell with you there. Oh, quick question. How many of you are with family organizations or represent families today? Please raise your hand. Excellent. And how many are you with MCH programs, Title V programs? Okay, we have a nice blend. So we know who we're talking to. Okay, thank you. So when I was doing just a quick little survey of, what could we make this to be, I ran across this AMCHP publication from 2016 about the process of evaluating true family engagement in MCH programs. And it was really good. It kind of comes up with what seems like a quite obvious statement that a full picture of family engagement requires the views of families and family organizations. That's kind of a basic starting point, right? Well, this document, and you can get this online, and you'll have the link for that later, highlighted some of the benefits and some of the perceived barriers about a true family engagement. And that's what this workshop is here about today, is you're going to hear some of both. And I won't read all of them, but I like the word perceived barriers because it's possible that some of those barriers aren't really barriers at all. And we have some experts here to talk about it. So with that, I'm going to turn it over to Sylvia Mann.
Turn that on. Thank you. To remember to use the clicker because that's what runs the tape recording part of it. So I am here to give you some background about the regional genetics networks, because some of you may not have ever heard of them, and that is the organization that we have our family advocates working with us on. So, whoops, I did it immediately. I used the wrong clicker. So this is our funding statement. We're HRSA funded, just like the Title V programs. The networks are funded across the country. So if you look across the country, you can see that the entire country is covered by one network, one of the 7 networks. Again, funded by HRSA. The main goal of our regional genetics networks is to improve access to genetic services, education, and resources, especially for medically underserved populations, by sharing resources within and among the regions. We have participation from public health, family advocates, genetic specialists, primary care providers, third-party payers, maternal and child health programs, and other related programs such as the LEN program. I've included a slide here with actually the websites of each of the regional genetics networks in case later on you want to go and contact or look at the website of the network that covers your state. So coordinating the networks is the National Coordinating Center, which is funded through HRSA again to the American College of Medical Genetics. Mike Watson is the executive director and Alicia Keene is the project manager. So their job is to help coordinate all the regions and activities so that we can work together better. So that's just a nice picture of our last regional summit meeting with everybody from all over the different states that come. So our region is pretty big. We are the western states. It's Alaska, California, Guam, Hawaii, Idaho, Oregon, and Washington. Our leadership in our network is actually from our public health genetics and newborn screening programs. That's not always the case for all the regional genetics networks. Each network gets to pick who their leadership is. So in our region, we decided that our leadership would come from our health departments. We also have strong network partners, of course, with our family advocate leaders, our genetic specialists, our primary care providers, our LEN programs, and then, of course, because we do a lot of telehealth now, our telehealth resource centers, which is another HRSA-funded entity. Our challenges, well, our region spans 8 time zones in the international date line. That's not that big a deal, right? Because the New England region, well, they could drive and have a meeting every week if they wanted to. So we have, during one part of the year, Monday to Thursday, 1 hour during the day where everybody is at work. So it's challenging for a conference call. Now, we can't do calls on Friday because that's Saturday in Guam. And then we have another part of the year when there's daylight savings time where we have a full 2 hours Monday to Thursday where we can schedule a conference call with everybody. So we do try the best we can, but one of the things that we've utilized a lot is that we record all our conference calls and our webinars so that whoever can't make it during that 1 or 2 hour block of time can actually still participate in our regional activities. We also have very big states. We're superimposing Alaska onto the entire country. Now, we're trying to serve people in Alaska. We've also got California. I mean, they're basically 2 countries. Then we've got Guam, that's closer to the Philippines than it is to the mainland US. So our challenge is we have a lot of geographical distance. We have our time differences. Also, we have very high travel costs, so when we need to work together, it's very expensive. All the regions get the same amount of money regardless of geography or who you have to reach. So it's the same no matter which region you're in. I just put up our guiding principles because we did come up with guiding principles. We also, at the beginning of our network, had some guiding principles that included respect and things like that. And after a while, we realized we didn't need them anymore because everyone was very friendly. We had no infighting. Everyone's respectful. Everyone's treated equally. So we said, well, we're not in kindergarten. We can take those off of our guiding principles. But when we first started, we wanted to make sure that everybody knew what our goal was and we wanted people treated in the network. So I want to thank everybody. And now, it's going to get colder tomorrow. So we welcome anybody to come visit us in Hawaii, and that is Diamond Head. Our offices are actually right on the other side of that Diamond Head part.
Okay, so to really learn from Sylvia, we're going to ask her a few questions, and there'll be time a little bit later for some questions too. And then what we'll do is from our family point of view, we're going to talk about how this participation in this really massive effort has benefited our family organizations, because it definitely has, and we each have our own take on that. But I want to start out by asking you, Sylvia, so you're a pro at this, and you're really good at math because you can figure out all of those time zones and hours, which I'm always so impressed by. You outlined some of the barriers. What about some of the more personal barriers that you may have had, say in working with some of the professionals in the network? Did you encounter any barriers that you should tell us about?
So I think I was very fortunate because I actually work in an organization in the health department in Hawaii where from the beginning, over 20 years ago when I started there was a lot of family engagement already, and we had family advocates that were equal partners at the table with us. So to me, it's a foreign philosophy to not have that happen. So when people tell me that that's not happening, I sometimes can't understand it because that's just not the way that we run our programs in my regular job. So when we created the network, we never thought of having family advocate leaders as a barrier. Our biggest barrier with that was trying to include as many as we could because we made a conscious decision that we wanted to touch as many families as possible. And as I told you, we have the same amount of money as everybody else. And we pay for all travel when we have meetings or anything like that for everybody, including our family advocates. So we decided very consciously to work with the HRSA-funded family-to-family health information centers and the state Family Voices chapters because we knew that they touched a lot of families. So we wanted to make sure that we could help them touch the families with the genetic resources that we had.
So in some programs, of course, there are onesies and twosies parents involved, and so what you're saying is you said you'll get more reach, you'll spread it further if you work with an established organization. Well, we're very lucky that we get to be that organization. So tell us a little bit, I see you've got some staff in the audience. Tell us how it works from an administrator's point of view to actually make the money work, make all those time calls work. What kind of support do you need to make this work?
So in our network, we wanted to make sure that the family advocate leaders had their own voice. And one of the ways was we always set aside budget for an activity that they wanted to do. We would have paid for more than one activity, but when we had a meeting, they all said, we're so busy. We only wanted to focus on one really meaningful activity each year. So what we do is we set aside budget for that. The family advocate leaders actually decide what they want to do within our network for that activity. And so we support that activity by providing staff time, the money, video conferencing, any of the other things that would support doing the activity. If we had to hire a consultant or we had to bring in other people to help with the activity, we put it all in the budget. So we wanted to make sure that the family advocate leaders made sure that they had a good voice in our network. We also want to make sure that they're prepared for our annual meeting. We have an annual regional summit where we bring together all our partners, and we talk about complex genetic things. So what we do is we hold a half-day session before our regular annual meeting, so that we can have a good discussion with our family advocate leaders about what's coming up on the agenda. What does this mean? What are we doing? How are we doing it? What process we're using, so that they can be prepared to participate fully with everybody else in our network when we do our network meeting and make decisions about what we're going to do in the network. Because the worst thing would be to throw our family advocate leaders in there and they have no clue what's going on.
Yeah, I agree with that. The first time I heard the term Arctic something, 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 I felt like I'm in the wrong room, but it is very helpful. Those webinars ahead of time are super, super helpful in the time ahead. So last question, could you think of any examples of ways that the networks or the F2Fs have helped the Hawaii Department of Public Health in the genetics program at all? Has there been any ways, and I'm thinking of maybe Cowie's group, Cowie's F2F. Has there been any examples you could share that have been kind of an add-on benefit?
So Hilo Pa'a is our family-to-family health information center in Hawaii. And with them, we've always worked with them as the genetics program in the health department. But the good part is that our connections help them with developing projects. So right now, actually right at this moment, Cowie is developing a project with us on our telehealth initiative. So she decided that that would be her family-to-family health information center project. But I think one of the great things is with all the states, our family-to-family health information center and family voices advocate leaders have been linked with their state public health genetics and newborn screening programs, and also with the clinical providers. At our network meetings, we do not use any titles. There's no doctor or anything at our meetings. Everybody, it's the first name. Everybody's super friendly. Everybody gives hugs to everybody. We're Western states, so we're just very, very friendly people. And I think there's a big respect for everybody's point of view at our network meetings and during our network activities. We also have all the family advocates participate in all our work groups that we have for each of the activities. They have an equal say in what we're doing in our activities as anybody else does. So I think that the family advocate input has really helped our activities be better than they would be if we didn't have it.
Thank you. I hope that's the case. I do know that when we split up in the meetings, we do move. I'm not with these ladies in our work groups. I'm with other professionals in the work groups, and I do absolutely feel like there's an equal voice there. And I think you guys would agree as well. So there'll be time to ask Sylvia some questions a little bit later. Before I pass it on to them, I want to say really quickly kind of what the Oregon Center has gained from this relationship. And, definitely the exposure to the experts in the fields of genetics, that has been really important. And we've taken that and spread it in the state of Oregon, working with the newborn screening folks that I would never really have known existed except for this partnership. We have the access to the national centers because each annual meeting hosts representatives from our national centers, and I've learned so much and gotten so many good free resources that I use. In fact, one of the things that families really love are some of the new genetics booklets that come out that are free, and so I learned that I could get those for free, and we bring them home, and then it's just families love them, and it's a very important partnership. And then, of course, access to my peers in a way that we wouldn't have had, even though, those are big states out there and we don't ever really get to see each other except for at this meeting. But one of the outgrowths from this relationship is the three of us have done something separate from the collaborative where we've gotten together and done training for our own staffs. And so that is a third benefit. So there's many, many others. So I'm going to pass it on to Angela and Jill, and they're going to talk about their experiences.
So rather than us going through, we were originally going to talk individually about it, but we decided that we'd rather just kind of have a conversation about some of the benefits that we've seen. And Tammy mentioned, obviously, the benefit of working together across borders, because we do share a lot of families. I know a lot of our families will go to Oregon Health Science University. I know I practically lived there when my daughter was little, and then we have a lot of sharing of families, certainly in the northern panhandle of Idaho, Spokane, Coeur d'Alene.
Spokane and sometimes to Seattle Children's. And I wanted to kind of link into, Tammy was talking about, we did some cross-state training where we kind of worked with each other. And Alaska was pulled into that too. Mm-hmm. So we would have meetings where telephone meetings, or where we would share resources and share pieces. And I really think that being a part of the genetics network really created, because of the way the network was set up, really created a platform for us as family-to-family health information centers to really look at that cross state travel, because we do have families that come down from Alaska to get care. And we do have, families, especially in the farm workers communities, that go across those state lines to get work. And it's how to link those families in the next state with those resources. If we already have those in place, if we're already communicating, then those cross link pieces work far better for our families as they transition. And having those relationships, because of the relationship we had starting with the Genetics Collaborative, I think really helped with that in building a stronger region. Mm-hmm. Because I call Cali for things when families come from Hawaii and vice versa. So
we were even talking this morning. We run into certain dilemmas with helping families in our states, these big rural states, and so we can brainstorm with each other on what. The first thing that Jill said was, well, ask Mary in Alaska. I bet she has that same issue. So we really can bounce some ideas off of each other. But you also both mentioned the genetics network is probably one of the most favorite things that I get to participate in each year, and I've been doing this, I think I've been coming for seven years now, and it really was sort of an epiphany as going through it, that I realized we really don't have any titles, and there isn't that power imbalance that I think was mentioned this morning. Everybody is treated equally, and parents, especially parents as from advocate organizations, a lot of times maybe we don't even feel as valued. That's come up in other conversations, that the parent voice isn't as valuable as the professional voice. And we're really seen, at least in this network, as parent professionals and valued for our participation. And the parents that we also bring to the meeting from our states, I know I've brought parents who have kids with specific genetic disorders to the meetings, feel equally as valued. And so the participation has extended to how we do our work in our office as a family-to-family health information center when involving parents and engaging parents in other types of projects, not necessarily just genetics, but it's really shifted how we do that work in our office with families and how we ensure that they're valued and their participation is valued.
Well, and I think it also provided a model. So that when, for me, as I stepped outside of the genetics network and with our Title V and with some of the other, with our behavioral health state entities, it allowed for me to kind of move at a different level and to provide information and ideas that were based off the model that we had in the Genetics Collaborative. In Washington State, we have developed this collaborative of family organizations where we all get together and we all look at our pooled outcomes, and we all look at just kind of that how we as organizations can work better in our state to provide support for those. And it's it's really nice because our Title V is a part of that, and they support that. They're that underlying piece that gives us kind of that infrastructure, so that we can continue, and it's self-sustaining in some parts. It isn't a highly funded project. It's us getting together, but it was modeled after, in my view, kind of what we do as collaborators in the network, as family advocate organizations.
So, and also mentioning the connections that we've made within our own states with folks in either public health or newborn screening or MCH. I think that participation in this network, I can call it collaborative, in this network has really strengthened those relationships that you're just talking about. So I did not know, it was through that network that I think there were some mutual benefits. I don't think a lot of people in my state from the department knew who we really were as an organization and what we did and why we do it. And so that was beneficial to them to sort of realize, oh, there's a resource, there's an organization here that actually serves all these families throughout the whole state. And then it helped me as the director of the organization to develop those really important relationships with people in public health, and just shout out how many years later, raise your hand, Jackie. We're now developing. We're signing a contract as of today, or tomorrow, probably tomorrow because it's Sunday. But a family engagement contract with our Title V in Idaho, specifically to work together, and that wouldn't have happened without this level of involvement. I don't believe with our organizations. Okay.
Yeah, so I just want to say thank you. Last some things that work from the family side that Sylvia's group does for the family groups that I would urge might be a model, and you can correct me, but some of the things are consistency. We know what to expect from the network, and that really helps us. We know when we're going to have meetings. We know who's going to be on them. Our roles are really well defined. It's not left for us to figure it out. That's a really try to model that if you can. The democracy we've already mentioned. We do feel we're on an equal integrated basis. The staff support has made it very easy for us to participate, which is why I believe we are so consistent with our participation. I don't think there's a lot of turnover. There seems to be a lot of, we're there. And we're not overwhelmed with communications because Sylvia's got a really great approach to communication. And so we know that when we get it, we need to look at it because it's going to be important. With that.
Okay, am I moving to these?
I think the thing with communication, though, it isn't me necessarily. We take a vote in our network, and all our partners hate email. And they hate constant communication. So we have made it a science on how to touch them when we need to, and that they need to know everything, and give them options for people who want more information. So it is actually just a response to everyone in the Western states who hates a million emails in their email box. And I just wanted to say that for our partners that aren't here, like California, they recently were asked to finally actually participate in their state newborn screening program and genetics program to help them with family engagement. And they haven't done that ever. So we were able to finally link those two. We just kept putting them together, and finally what they figured we should actually meet while we're in our own state. And they now are very actively participating in their program. So I'm very happy about that. Put up your stuff.
Okay, so a couple of other things on that line. The project, this network actually, again, as I mentioned, it was sort of an epiphany of, of what meaningful family engagement really is. And I will say from our organization, as the Parent Training and Information Center, also under the U.S. Department of Education, we've done a lot of work in school systems around family engagement. We were working with a project for the last 5 years, in fact, on helping districts engage families. And really, it kept going back to family involvement and these what are just sort of random acts of, a family, one time they'll come in, they'll participate on something, maybe they'll do a survey, maybe they'll do provide some input, but it's not meaningful family engagement until it's systemic, and until families are actively involved in policy and systems change, and that their voice is valued and repeatedly valued and brought back to the table, and that it's not just that one single parent. I know we heard a lot about that this morning for those that were in the family engagement presentation earlier today, that tokenism is what we genuinely are avoiding, and working from a framework of systems change and that type of family engagement. Jill and I both in Washington and Idaho have also been part of a Family Voices project called Family Wisdom. It's through PCORI, the Patient-Centered Outcomes Research Institute, where we've been working with focus groups on targeted focus groups around specific health issues. So in our state, and in yours, it was around healthy activity, healthy eating, healthy lifestyle. And in our state, we were working with Spanish-speaking families, and Jill.
And we worked with tribal communities on kind of building champions within the community, and community-driven activities, community-driven outcomes, so that they could choose what was important to them as a community, and then they could work forward. That created a more sustainable project and more stake in what was happening. And that was kind of the base of what we were doing.
Mm-hmm. And so that is continuing, and now it's become more of a learning collaborative where we're sharing with other F2Fs on their projects and how to do that. So I'm going to click. Many of you saw this morning, the continuum. I wanted to just pull up two. In another meeting that we had recently, I shared with that collaborative, that Family Voices collaborative, the two different frameworks for family engagement. And these are just as examples, but this is obviously the continuum and the framework for family engagement related to healthcare. And you guys can find this very, very easily online. So, but essentially you can see that from the individual, from our organization, we would look at direct care as the one-to-one assistance that we provide to families. Organizational design is where you have your advisory committees and your focus groups and those types of things. And then your policy making can be the same, and that is where you can get families engaged in that long-term systemic.
Well, and one of the things that's happening in Washington State with the collaborative, the Washington State Leadership Initiative, is how to build that sustainable. Did I say it wrong? Okay, thank you. Leadership Initiative. There we go. I forgot the leadership. Is that we're looking at that sustainable policy level piece within our state committees and our state advisory groups, that the family and young adult voice, it becomes a valued part of what those committees do when they look at policy level initiatives that they have in our state that impact those individuals. So taking that model and kind of taking it to the next level for all family organizations in our state.
So the other sample model or framework that I used was one from that school and community framework. You're going to see really similar activities and similar philosophies through there, but ultimately it's really almost both. It's a continuum, and it can be linear or it can be a circle. Mm-hmm. So it's essentially, you've got, I'm going to show you on the next slide. I think I'm going to show you on the next slide. You basically are talking about building trust. And I think that's what the Genetics Network has done with families. It's all about engaging families in ideas, sharing their wants, their needs, and then building a trusting relationship around that in order to start to develop policy and change. And that's really what engages families. Once they're in a trusting relationship and they know they're valued and respected, they're going to be engaged and remain engaged. And I know I've been serving on, I've served on committees since my oldest daughter is turning 22 this month. I was on the infant toddler committee, so that's how long I've been doing these things. And I know I've been a token parent where I had no idea why I'm at the table. And I've worked through systems to realize that I have an important place at the table. And these different frameworks, whether it's in schools, community, or healthcare, are really usable for us as professionals and us as parents to know what it takes to be engaged and why we're there. So that last slide, if you can, it's hard to read, I know, my circles. I want to just give you an idea, but then I have possibly a handout. Yes, Sarah has the handout. So just the colored ones, yeah. Those are the ones that we'll hand out. And I made 50. I didn't realize that we would have a room that fit 70 and standing room only. So, but really what I wanted to do is just show this sort of is more of a planning cycle, if you will. So for us in that PCORI project, we had we have a goal for family engagement. What's your purpose, first and foremost? Why do you want a parent involved or many parents involved? Because we're dealing with a targeted, culturally diverse population, we want to be sure that we understand the culture of our targeted audience of family members, and that's not just, that's any culture. I think I heard earlier, was it yesterday, working with youth, that's a culture in itself, And our families, as families of children with disabilities, that's a culture, so or special healthcare needs. So third, that one's the hardest probably to see. That's ensuring that you have cultural brokers participating. So you all are familiar with independent living movement and the whole nothing about us without us, civil rights. And so that is my view on cultural brokers. I like the term cultural connectors a little bit better than cultural brokers, but we need to have people from within the community participating and including and directing the others from within the community. Next, we've got the recruitment of families, and then focus groups is what we've done, but that's the place where you're getting ideas being shared. So that can look a variety of different ways. Developing trusting relationships comes out of that. And then from there, families are providing strategies for solving problems or achieving goals. And so that is meaningful family engagement. When you're at that point where families are actually bringing the solutions to the table along with any other partners, that's where the relationship is built. And then finally, you're back to families then become empowered in their own communities to take that out to their own communities. And essentially, then you're back to the planning cycle, right? You're back to a new goal and a new purpose. So your activity, and we can take questions as well, but the activity, I gave you that circle to really look at that from your own work and your own framework and see if you wanted to fill in, if you want to spend some time and fill in those, maybe they're different for you, that whole process. For family engagement, and if you're interested in filling those out, we would love it if you would, and maybe put in your own words of what's meaningful for you, and we'll take questions, and then we'll do a shout out.
Actually, I was wondering how many people work with their regional genetics networks?
Okay. We're going to have questions from the floor, and we can run this microphone to you so we can hear the question. Here's one right here. Oh, good. I am so happy.
Faster. Brad Planey, Arkansas. Maternal and child health is very broad. There's a lot of domains, and it's everything from infant mortality through school health to teen pregnancy. How do you recruit families that have a variety of experience that can contribute to this, a variety, so that they're not all looking through the same lens at the problem?
Well, one of the things I would say in Washington State as the Family to Family Health Information Center is that I'm housed also with our Parent Training and Information Center, which reaches into all districts. We have fingers in all the districts. I'm connected with not only the children and youth with special health care needs portion of the maternal child and health, but also the other maternal child and health initiatives and connections through this. So middle child, we have a middle child summit every year that kind of brings all that impact for those kids that fit from school age up to adolescence, and it's kind of our outreach goes beyond that focus. It's like in some of the programs that we do, collecting information with families that we connect with in the schools, the resource fairs that we do, we make kind of pointed touch. I go all over the state. I drive all over the state and do family outreach activities so that I can find champions within each community to kind of reach out into their community to bring that information back if there's targeted asks. So it's kind of one of the benefits of doing Family to Family Health Information Center, because it's around the care of the kids in our state, and it looks at the impacts for them. So that helps me kind of get a broader outreach when I'm looking for getting information.
Well, I'll just add to that. I think we do an awful lot of work in our organizations with community partners in every arena, because we work with families who have kids from birth to adulthood, and every single issue. There are a lot of people in my state that think that I have a massive staff, an army of, we thought there was like 30 or 40 of you. No, I have 8 total. But we are at every table, literally at every table. And so recruiting families, it also comes through our parent leadership training. And I think all of us have some form of parent leadership training that we do, and I would say probably most F2Fs do. And so we have targeted every year, we train parents to become leaders through a curriculum, and we also then have developed a parent mentor network in our state so that they can communicate with each other on the issues that are happening in their personal lives, and also those issues that are taking place that are just maybe trending issues throughout the state. So we will identify families that are across a broad spectrum of issues and needs, and that's not a problem to find. We also all have databases, and so we can go in and search for families that might be a good fit for a particular project.
I'm just curious, how are you measuring family engagement?
Oh, how are we measuring family engagement? So in our particular organization, we use Salesforce, which is a database system, and we measure one-to-one touches. So if a family calls in and asks for specific information, that is measured, that information, and we take demographics, but also we look at what they need, what they are asking for. But we also measure trainings. We also measure information that goes out, so dissemination of informational sheets, newsletters, Facebook posts, Twitter, so we have a broad spectrum that HRSA asks us to look at when we do family engagement. And then we also have on those one-to-one and on those trainings, we also have evaluation points that asks families and individuals who are part of those trainings to look at what they've learned, how it's impacted what they're going to do moving forward. They feel, it's an internal ask, but we do evaluations on all across the board on what we do. So those are our touch points for collecting data.
We're also measuring, in our organization, we're measuring the number of parents that are participating on committees, councils who have gone through our parent leadership training, and they're going on to more of those types of committees, councils, work groups where they're winding up, and typically around 70 to 80% become very actively involved in the community, and that is a measurement of family engagement.
And then, so for the network, we started out with papers. We have an evaluator, an outside evaluator. So we had surveys of involvement of all different participants in our network. And then we also did telephone interviews. We did those for several years until finally the evaluator said, they never say anything bad about what you're doing, so it's kind of boring to keep doing this. So we said, okay. So more recently, we do sporadic surveys, and we also use the Working Together tool, which is a survey of how well you work together as an organization or a network or a group. So we've been using that because we feel working together is probably what our goal is, rather than are you happy?
Yeah.
And I'll just say, in Oregon, I thought I saw our assessment and evaluation coordinator in the room. I think she stepped out. But we are actually going to be working with Title V SHIN program to help design a new way of doing, in addition to what Jill and Angela just mentioned, looking at some other ways that maybe we can do it. So that's on the board pending our new funding.
We also do have, because Jill and I both work with our schools and school districts and our state departments of education, there's a Family Indicator 8, family engagement survey that the state departments of education put out each year. And so we actually use their data as well to see how families are responding to that survey and incorporate that into how we're measuring family engagement. I don't know if it's really good data, but it's data, so.
With the parent leadership training, how do you reach the more rural parts of your state?
So in my army of 8, I have one region. So I have 2 regional staff, and I'm hopefully going to get one more. But I have one staff person that works in North Idaho, and one who works in East Idaho, and then our main office is in Boise. But they have really developed their regions. They go and they do trainings monthly. We do an honor roll tour where we go to the tiny little towns a couple of times a year and really market that with our partners and in the community. And they connect with support groups in those regions, and let me tell you, we find we get parents in some really remote places that want to be actively involved. And to be honest, technology is our friend, and we're able to meet parents where they're at more and more without having to go into the community. But for us, we really do want to go in the community, and our parent leadership training takes place in a different region of the state each year. And so we are going to some place called Laclede, Idaho, in March. It seems really remote and rural, and it's up in North Idaho, and I've never been there, and I'm going. So, but yes, we really do. And I will say, even our monthly trainings and our honor roll tour, you'd be amazed. Once you've got that parent, once you've got a good relationship with a parent, that's where the biggest turnout is going to be. We've got a small town called Montpelier. It's down in the southeastern part of the state. We had more people show up in Montpelier, I'm probably even pronouncing it wrong, than we do showing up to our monthly workshop in Boise. So I would say that our rural families they're hungry for participation and information. They want to be a part of something because it's not as easy. So accessing them and then keeping that connection to them is really important too.
Well, one way I've done it has been subcontracting, because I'm in one space and our parents aren't under our family organization, but we collaborate really well together. And I do subcontracting with those parent-to-parents that are in those communities that are kind of rural, and they do the training and they do the outreach because it's already part of what they're already doing. And it's been a really good partnership. I also partner with a couple of our dad's organizations. So, and they've gone and done trainings in one area, which is Okanagan County, which is north central, huge, a lot of off-the-grid families that live out there, frontier areas. And we did a family outreach organization thing where we had families come just to meet and do resources. And we thought maybe we'd have 30, 40 people. Well, they Facebooked to each other, and we ended up with 250 families that walked through the door to get resources that hadn't really connected with those resources in their area. So it's finding those links, like she said, that champion, and they push it out, and then people come to connect with things.
I would just like to I'd just like to remind everyone that if you weren't aware, the families to families, like the networks, all get the same amount of money regardless of how big your state is. So we feel pretty lucky in Oregon that our 90,000 plus goes as far as it does, because Oregon's a relatively small state. But what it means is we have to prioritize those dollars for those outreach in rural areas, and that's what we did. We simply said, we're going to drive. And we maximize those tax dollars as much as we can by doing things. You know, it's literally, you get in a car and you drive to one small town, do it in the morning, go to somewhere in the evening, spend the night, morning, night, and we'll do 6 or 7 in a row just to try to save that money, those precious few dollars that comes with the grant. But we find that it's really important to be there with our boxes of resources, with our human touch, because it's a myth that all families in rural areas are depending on technology, because they just aren't. As I like to joke, most of their kids are online all the time and they can't get online. So yeah, it's you just prioritize it and you make sure that you do it. We have time for one more question? Okay. Anyone else? All right. Well, ladies, anything else that you wanted to add? Any last parting words that you'd like to add? And Sylvia, any last advice for your peers?
So if anybody wants to connect with the Regional Genetics Network that hasn't, if you want to give me your name and contact information, I can pass it on to the project directors of the regional network that oversees your state.
I would also just add, if you don't know about your family-to-family health information centers and your Family Voices affiliates, please find them. You have one F2F in every state. There's only one per state. PTIs are a little bit more, the Parent Training and Information Centers. Those are population-based, and they're not always housed in the same organizations. They just happen to be in Oregon and, in Washington and Idaho. And so find your F2Fs and your Family Voices affiliates, because that really is your connection to the larger group of families.
And thank you very much. I'll point out one thing. There's a few copies of this sample on your tables. This is just something that we use to kind of get programs thinking about what it means to have families involved. So this is maybe for some of those that may be beginning and dipping your feet into getting family engagement. These are some questions that we ask people before they even invite that first parent. Ask yourself these questions. And so you're welcome to take one of those. Thank you very much. It was a pleasure.
Thank you.